flood, did you?
Well, whatever happened to me, I fall over. You'll be thanks to
Go. Hey. Well, good afternoon, everybody. I appreciate y'all being here. My name's Tim Graves. I'm president and CEO of the Texas Healthcare Association. I'll be joined today by Ali Besteiro, who is the president of Texas AARP, Mr. Carlos Higgins, who's a longtime member of the Silver-Haired Legislature, and Buddy Parker, who's chair of the Texas Coalition for Business Long-Term Care. I want to be clear, the reason we're here today is not to be critical of the Senate budget that just passed. The Senate worked long hours, made some hard choices, and dealt with many competing demands. But I also want to be clear that from this day forward, as the budget process moves along, we want to make sure that adequately funding Texas nursing home care is a top priority. And just to give you some context, the state every biennium does an estimate of what the funding level should be for all kinds of Medicaid providers, and we're one of them. It's done in what's called the consolidated budget. And in that budget, there's an estimate of what the cost of care would be for nursing home providers in the next biennium that we're working on. That budget, that estimate, shows that we're 17% off of where the rates should be to just cover the cost of care. That's over a $300 million shortfall in general revenue. And you know, we do throw around a lot of big numbers, but I want to give you a couple others just to kind of explain where we are today. A couple of years ago, actually in 2011, we had a $58 million reduction in nursing home funding. Just recently, we had a $51 million reduction in Medicare funding. And those two programs work together to make things work in Texas nursing homes. So we can continue to be in this funding squeeze. And I know you ask yourself, well, what does that mean? And we did a survey of our membership just in the last month or so. And I want to report to you that 84% of folks who responded are having to freeze wages. 82% are deferring facility expansions and equipment acquisitions. 75% are reducing or changing staff benefits. 31% say they may have to lay off direct care, which is not what we want to do. And 18% may be forced to close. So the economic situation is not good for Texas nursing homes. And we want to make sure, as this budget process moves along, that adequate nursing home funding is decided upon and put in the budget. Our basic position is that the legislature should prioritize funding for nursing home care to cover the cost of care. That's fair, and that's the right thing to do. Now I'd like to ask Ali to join me up here, and she has a few comments.
Thank you, Mr. Graves. I'm going to pull this up a little bit, if you don't mind. Although I'm loud enough that I'm sure you'll be able to hear what I have to say. I am Ali Besteiro, and I am the state president of AARP here in Texas. AARP has over 2.3 million members in Texas, so this issue is an issue that certainly impacts a large percentage of our members also. As a consumer advocacy organization, AARP is very concerned about the continued underfunding of Texas nursing facilities and what that means for our most vulnerable Texans. Texas ranks 49th nationally in Medicaid nursing home reimbursement rates. And we don't think that's essentially a good thing for Texas nursing home residents. Retaining quality nursing home staff, both nurses and direct care nurse aides, is very difficult at the current funding levels. Texas nursing home reimbursement methodology recognizes inflation and the normal increases in business cost experienced by nursing home providers here in Texas. But the legislature has repeatedly failed to fund those reasonable increases with appropriations. Texas nursing homes are long overdue for Medicaid rate increase. And we believe that we must protect the frail seniors in Texas nursing homes. And Texas can and must do better for those vulnerable citizens. Thank you.
Thank you, Alec. Buddy, you have some time?
Good afternoon. My name is Buddy Parker, and I founded the Texas Coalition for Long-Term Care Businesses here in Texas. I'm here today as a businessman, but also as a senior advocate, as I'm in the business of providing goods and services to our state skilled nursing facilities so that providers can deliver high quality of care to the elderly. As my business and many others contribute to a robust, long-term care sector in this state, I and coalition members have sought to educate legislators about the impact of an enormous Medicaid funding gap and how it goes beyond the walls of a skilled nursing facility. As Tim noted, facilities across the state are already cutting back on services and programs, vital components to the operation of a nursing home providing skilled care. As the ability to purchase goods and services decline, so do the businesses that provide them and the number of people employed by those businesses. It's a dangerous ripple effect. Throughout the business community and into local economies, the domino effect will continue. And when rural skilled nursing facilities suffer financially, so do the businesses that supply them with the goods to deliver quality care. It's important for the policymakers to understand the real ramifications of not addressing Medicare funding for skilled nursing care. And while I've talked all business, I want to end my remarks by saying long-term care business coalition members understand our contribution to the elderly in the state of Texas. We respectfully ask our legislators to recognize that and make adequate funding Medicaid a priority. Thank you.
Carlos?
Thanks, Tim. I am Carlos Higgins. I'm a member of the Texas Silver-Haired Legislature. And this organization was created by the Texas Legislature about 26 years ago to speak up on behalf of seniors and bring recommendations to the legislature. We've been doing that each session since. These signs, you'll note, say "Stand with our seniors." Well, we not only stand with our seniors and for our seniors, but we are seniors, and we are concerned about the health and well-being of our fellow seniors. And a large part of that concern has to do with the health of the nursing home industry in Texas, both the health today and in the future. And when you talk about the health of them, you say compared to what? You've heard some talk about a comparison with other states, and in that comparison, I think you have to agree readily we're not doing so well at 50. And if you look at the individual figures about how much lower we are in actual dollars than most other states, you have to conclude there's room for improvement. And on behalf of all the seniors we have now and all those that are going to be here in a few short years, we believe we need to find a better way to improve our nursing home industry and make sure it's healthy in the future. Thank you very much.
Thank you all. That concludes our comments. Be happy to try to answer any questions.
One thing that you folks didn't mention, I want to be clear on this, that you didn't call for the restoring the cuts of 2 years ago.
Well, I'm glad you asked that. The 17% increase I referenced
Yes.
would include the restoring of that 3%, but also, actually recognize the cost of care, so that we need a 17% increase just to get to the cost of care.
Okay, and the other thing too, 2 years ago, one of the big concerns was that grandma was going to be thrown off her nursing home. Are we still talking about the same
No,
thing?
no, thank goodness we're not. But just to be clear, the budget proposed this time, well, last session, would have had a 33% funding reduction for Texas nursing homes, a $1.4 billion reduction in the biennium. So that was an alarm bell and would have closed, I can't give you a number, but would have closed many homes across Texas. We're not in that situation anymore. But, the data I gave you on the how the facilities are having to cut back in a lot of areas is very concerning.
And I believe the gentleman here mentioned rural, were you talking about?
Yes,
rural? Yes. What exactly are the needs of, are they more pressing, the needs of nursing home in rural areas than urban areas?
The goods and services that the providers of healthcare need are common across the state. I'm sorry. They're very common across the state. Whether it's medical supplies, mobile x-ray services, pharmacy services, or even food service. Those are common to the long-term care providing industry. And as we move forward, those goods and services are being cut back daily because people can't afford to pay for it. It affects the business community because when the providers have their funds cut, then it falls down to us just like a domino effect. We end up losing employees and cutting back staff and having to change product lines, which causes effect of quality service that the providers can give.
Hey, Tim, I'm guessing you took this message to the senators as they were putting the budget together. Didn't happen. What were you hoping?
Well, the budget process, at least in recent sessions, has been one of initial, product, just like we had this afternoon. We did obviously give them our position on what we thought ought to be done, and as they have done in the last several sessions, they've taken on some hard issues in Senate Bill 1, but they also will be taking up the bigger issues, the bigger dollar issues as the session moves on. That's the way it's gone every session in the last several sessions. So we are hopeful, confident that we can get some increase that's needed just to cover the cost of care, but it's going to happen at a later time during the session. Anything else? Okay. All right, well, thank you all for coming.
I can have a favor for this, have a list of who was here, that way if I have any follow-up questions, I can.
Rebecca, do you have a written list of who's here, or could you write one up?
Yeah.
You bet. Thank you, Ollie.
Thank you.
Very much. Carlos? Buddy? Thank you. You did. That's good.
Thank you so much.